Hi, it's Dr. Garth Fisher, and welcome to The Cutting Edge. Today on The Cutting Edge, we're joined by a true giant, legend, and icon in the field of sports medicine, Dr. Neal Elattrache. He's not just one of the most respected orthopedic surgeons in the world. He's the man trusted by the greatest athletes of our time, from Tom Brady, Kobe Bryant, Aaron Rodgers, Shohei Ohtani. When a career is on the line, they call Dr. Elattrache. He's the head team physician for the Los Angeles Dodgers and the Rams, a pioneer in knee, shoulder, and elbow reconstruction, and a trusted advisor to countless high-wattage A-listers across sports, Hollywood, and beyond. It's an honor to welcome the legendary Dr. Neal Elattrache to our show. So welcome, Neal. Thanks for being here.
Garth, it's an honor to be with you. Really, really is.
So I'm just going to go back for a minute. I think I've known Neal for 25 years, and we were operating kind of in the same facility, and I always like to watch other people operate, and so I went upstairs. He was on, or maybe he was on the third floor, and I went and watched him operate because I like to see people's hands, and I just thought, wow, this guy's such a great surgeon. His hands are so, you can tell when a surgeon has good hands, and I always thought that, we're all smart, we all make straight A's, but a surgeon that's got great hands and good judgment, I think that's the best attributes of a good surgeon. And it's actually the hardest thing for a patient to even know. They'll never know your judgment. They'll never know how good your hands are. But it's so critical. But I saw him and I said, wow, what a handsome doctor too. And he's so good. So anyway, I've known him for a while and followed his career. And so we're just so happy to be here. And Neal, I just want to go through a bunch of questions, but what inspired you to pursue orthopedic surgery? And I know you went to Curl and Jobe. That was kind of a huge center.
I was the oldest child of an orthopedic surgeon and a registered nurse. And grew up in a coal mining town in western Pennsylvania. And when I think that it was, I can't remember making a conscious decision of, okay, I'm gonna try to be a physician. It was just watching my family and my father. Navigate a community that no one had much more than anybody else, and so, but everybody seemed to have their role to play, and I just got very, very attracted to the kind of role that a physician has in among their neighbors and in their community.
Sure.
I saw it in what I think, looking back on it, it was a very pure way, because it wasn't like you were going to make an enormous amount of money doing it, but you were going to be okay, and your family was going to be okay, but what it meant to the other people in the community and to the people that you associate with and everything was it really became the way I wanted to live. And my mother started the first Meals on Wheels there, and wow. It was literally like a Green Acres the Green Acres TV show, where yeah. Eddie Albert takes Ava Gabor and takes her to the farm. My mom grew up in Chicago, and went to Northwestern. That's where she met my father, and they ended up in this little coal mining town, and she was, just on the surface, looked like a total fish out of water. She's a beautiful woman and very well educated, and she found a way to really hit her stride and to really be meaningful there. Even though this was a completely different environment than what she grew up in, and so, it was sort of bred into me, I think, and so luckily I was pretty good at science classes and applied to medical school, get in, and from day one, I loved everything about surgery, so I knew I wanted to be a surgeon, and it really came down to just a few days where I finally had to make a decision during my end of medical school and actually even into internship, my surgical internship, that of what I wanted to do, cardiothoracic surgery or orthopedics. You know, they had an amazing plastic surgery department there at University of Pittsburgh, but you went through 5 years of general surgery before you went into plastic surgery in that program. Anyway, I don't know if it's
That's
like
what
that
I had to
everywhere.
do too. 5 plus 2 plus another 1.
Right, and so so I figured, okay, well, if I end up in general surgery, I still have that option open to me. But I was really drawn to either cardiac or orthopedics, and it came down to the final weekend because I had been offered a spot to be able to track through 9 years in cardiothoracic surgery, so I wouldn't have to reapply after 5 years of general, and I would be the first one that actually would be able to do that at Pittsburgh, and and I was just totally taken by the chief of cardiothoracic surgery there at the University of Pittsburgh at the time, Henry Bonson. He was my surgical hero, and then it came down at Pittsburgh in those days. They were taking care of the sickest cardiac, heart, lung type patients in that service, and it was the transplant center of the country at the time. Tom Starzl had been recruited, so he was doing liver surgery, and Henry Bonson had was preparing to do the first pediatric heart lung transplant. It just so happened it was when I was fourth year medical student and an intern, so I was in the mid '80s, and on that last weekend, the chief fellow, who now is the chief of cardiac at Cedars, Alfredo Trento.
Oh, wow.
He took me on rounds down to Children's Hospital. Just me. I was on call, and he knew that I had this big decision to make. And we had already made rounds, and so it was curious to me why we were going back. But we went back, and he went through the ICU with me, the surgical ICU, and there were 10 beds in the unit. And these were 10 kids that were just post-op. And we had just done the first pediatric heart-lung transplant that I went on the donor run to pick up the organs.
Right.
And I never wanted to go home, so I get back, and I wanted to stay and assist on the surgery. And so I started to try to present the patients to him again, and he said, no. He said, we've already made rounds. He said, but you know that about 6 of these kids is not going to be fortunate enough to ever leave here. And in those days, there was about a little over 60% mortality. Right. And he said, you're going to start to come with us, when we speak to the parents. He knew that I was he knew that I was sensitive, and I think he knew that, if I did this, that this was the environment I would end up in. If you went through that program in those days, you were going to end up in a university program.
He was trying to draw you in because he knew you were good.
Well, but he was also trying to say, I don't know if you're made to deal with the failure that is going to, cost these kids their lives. Right. And so dealing with the parents then and speaking to them, it's still, when I think about it, it is heartbreaking. It makes it very emotional for me. And on the other hand, I had these orthopedic guys that were taking care of, athletic, active people, and they were coming in broken, and they would do something, and if they were successful in fixing them, those people were going out and back into a active lifestyle, and those guys were happy. The residents were happy. The surgeons were happy. And it was the rare cardiac surgeon that in those days at that place that you saw the outward joy in them because they were dealing with such big tragic problems.
It's a similar story to mine because I really like cardiac surgery and trauma, but the same feeling that you're. So I got it. Yeah.
So I think it was a weakness in me, maybe a weakness in my ego. I wouldn't know how to face that kind of failure without defining myself as a failure. And I don't think I was strong enough to see what would come out on the other end, where now over 90% of these kids are surviving that. And it would be nice to actually go back and make a more brave decision to be part of that whole advancement. But I love what I'm doing, and I love when I see that people's trajectory in life, if it's a young athlete, that I can take care of them and they can do something for their education or make a living using their body. And so I can't think of anything else that I would rather do.
Then you end up at Jobe at the premier spot, and he took you under his wing, and now you're the premier guy there, and everybody knew Dr. Jobe. I think you made the right decision.
Well, it gave me everything. His belief in me and his confidence in me and the relationship that I developed with him and Dr. Curlin, that was professionally anyway the greatest thing that's ever happened to me.
So this is Dr. Garth Fisher with A Cutting Edge. I'm here with Dr. Neal Elattrache, who's the premier orthopedic surgeon in the world, in my opinion. He's taken care of more celebrities that have probably walked through Hollywood. And there'd be no NBA, no boxing association, NFL. I mean, if all the people that you operate on, and I'm very well aware of, patient privacy and that stuff, but things that are out there. But without you, I'm sure there'll be a lot looking, it'd be a different structure. We're going to get to your career. You're just starting at Jobe. What was it like training under him? He was such a legend.
Well, he was an innovator. He was, you mentioned surgical ability and talent. Mm-hmm. If you would have seen him and his hands flow, it was really, really beautiful. He at that point in my life, he was the only one that I had seen in my career that had the technical skill with their hands that Bonson did, the cardiac guy I was telling you about. But Frank Jobe was so elegant. He had big hands. He had 9.5 gloves.
Wow.
And those hands when the way he handled, the scalpel, he actually never did any arthroscopic techniques. He left that to us, to the next generation, and actually encouraged us to try to accomplish everything with less invasion and arthroscopically that he was doing open. Mm-hmm. But he obviously invented and developed the Tommy John operation. He also developed a lot of operations in the shoulder that for athletes that had problems, pain with pitching, and Oral Hershiser, dedicated the second half of his career to Frank Jobe, and Frank Jobe's instruments and all of the Tommy John memorabilia that he was once using is now enshrined in the Baseball Hall of Fame.
Wow. It's a big procedure.
Huge. And you think about the right now, 35% of all professional pitchers that get into the professional baseball will have a Tommy John. Mm-hmm. And these are now the guys that are now getting into the Hall of Fame. There's a big percentage of them. Last year's of the 2 Cy Young winners and the 2 MVP winners. Okay, so each league has a Cy Young and an MVP, mm-hmm. and so all 4 of them had operations that Frank Jobe taught me how to do. So I had operated on elbows on Skubal, and I can say this because it's all public, but Skubal, Ohtani, and Chris Sale. Those were all elbow Tommy John type operations. Right. And Aaron Judge was a shoulder. And so, without the advancements that he was able to make, you say sports would be different without me. Well, you multiply that by him for him.
Well, I'm a doctor, so obviously I know about patient privacy laws, and Neal hasn't told me anything, but these are all coming from my words. He's my doctor, and I remember the first time I went to see Neal was probably 20 years ago, and I walked in the office and I saw, I think it was John Elway, Oscar De La Hoya was in his. I said, I'm probably in the right place, because I want to be treated like a athlete. I don't look like
you
one,
are an athlete.
Anyway,
you are an athlete.
And then he came. I tore my rotator cuff, and I knew he had fixed Manny Pacquiao's and Kobe Bryant. So I said, "Yeah, I think I'm in the right place." And he repaired both of mine. They worked perfectly. He did the most amazing job. I never had any pain. I couldn't sleep for 6 weeks, but he did such a good job. But in part and parcel with all that, when in your career did you realize, wow, I'm the go-to surgeon for the top athletes of the world? What happened?
It was because I was in the right place at the right time. I was with two of the real godfathers of sports medicine. They were extraordinarily respected all over the world. And as a young guy coming up, there wasn't a minute during my fellowship I didn't want to spend with one of the two of them. Mm-hmm. And actually they had developed a great group. I mean, it wasn't just those two guys. The other people that were in the group were fantastic. They all became leaders. And so just being there at that time was an important moment. There's a lot of talented surgeons out there, Garth. You know that, and a lot of very smart people. Sort of the way the world turns, you end up in the right place at the right moment, and you're devoted to it. And somebody spots it, and I can't say how important having a mentor that has that kind of presence in your profession. If they take an interest in you, it's the greatest gift you can ever have. And so everything I have really is due to, where I was and who I was doing it with. And because the athletes were coming, and then you get endorsed by the guys that are thought of as the best in their field. And so, you're off and running.
Right. I think your Dr. Jobe was my Dr. Cannell. That was the same. Yeah. I went through my residency and I did so many facelifts and so many this and that. But as soon as I saw his work, I said, I'm forgetting everything I learned. I'm going to relearn this the right way. And he just touched me in
the
that
great
way.
thing about looking at you and your practice, and I noticed this because we sort of grew up together in medicine, sort of similar age. But the people that are also in your field in LA, and for plastic and reconstructive surgery, LA is one of the places in the world that people want to end up. And the other notable plastic surgeons, you had a great relationship with all of them. They all respected you. Most of them wanted you to basically take over their practice. And so I was around looking at it as a spectator, and there's no higher compliment than when another surgeon, respects another surgeon.
Right.
And there's not a single member of my family, if they need anything, that you wouldn't be. And so that's sort of the litmus test for me. And I saw some, big name plastic surgeons that were older than us that really, they had nothing but great things to say. So it's important to be in that community.
This is all about you, though, Doctor.
I understand, but
you're the top. Let me tell you. I operate on the wives of your patients, but you have the most respect for anything.
I got a few ideas of what you're going to do for me. So
I think before you, Dr. Andrews in Alabama, or he was kind of doing a lot of it, and then you just amplified that.
Jimmy was between my generation and Dr. Jobe's. Mm-hmm. So Dr. Jobe was there, and then there was Lou Yoakum, who was one of our partners, who passed away in 2013, and Jim Andrews. Mm-hmm. And so there's always been for a while there was just Frank Jobe in baseball medicine, and then there was Frank, then there was Lou Yoakum and Jimmy, and then came a smattering of guys. So there's always been a small group that were either studied under these people or
It's like a tree, like Sean McVay.
It's a tree. Exactly right.
Yeah.
Exactly right.
So when you operate on these Kobe Bryants and Ohtanis and Tom Brady's, how do you handle the pressure? I think I know what you're going to say because I go through the same thing. But at some point, you don't have any pressure because you're so comfortable and it's just enjoyable, right? Or
It is the most comfortable environment that I can be in.
Yeah.
Is the operating room.
Yeah.
And it's and the other thing too is I am ultimately prepared. Mm-hmm. The only times in my life in anything, whether it was a sporting event or piano recital that my mother was making me take piano lessons, the only time I was ever nervous was when I knew I wasn't prepared. I hadn't practiced.
Right.
So I have never not been prepared. And there's some operations that sometimes I have to do that really haven't been done or no one. And so, it doesn't. I always have gone down, found a model or a cadaver, and I've practiced the operation. So when I do it, it doesn't matter who the patient is. If you don't get so caught up in the gravity of this because there's so much money invested in this guy or whatever,
it'll ruin you if you do that.
You can't do it, and you just you have a problem that you have to take care of. You prepare yourself, and you go in, and if you're prepared, you're not nervous.
That's right.
I've
never been nervous in surgery except the first time I was in a trauma run, and I became the first fifth-year resident. And a patient came in. I'd done trauma runs hundreds of times, and I knew everything. But then I was the first day I was in charge, and somebody came with a blood pressure of 50. I thought, what the hell am I going to do? I have no idea. I've done this so many times, but I just had to. I sat on that steel table, and I had to look at it a different way. And I said, you know what? Instead of worrying about you're going to kill him, just say, no, I'm not going to kill him. I'm going to save his life. Twist this thing another way where you're not worried about the downside. You're just excited about the upside. And I never got nervous again.
Right.
Looking at something. So I know for you, the emotional weight that these people, the emotional energy you must have for somebody who's, the top athlete in the world and all of these that you, is there a time that you remember that maybe, it was more emotionally draining on you?
Yeah, I think that when you get to become familiar with the person, then there's a lot of the personal stuff that comes in, and I think that's, if you're ever going to take care of a family member or relative, that's you can't get rid of that. So when you know somebody, I think that that layer of whatever anxiety or whatever is in you, but I think that probably it's the personal feelings that get involved.
Yeah. You specialize in knees, shoulders, and elbows. I think you could probably, remove a toenail better than anybody else. But how did you come up with those three?
Well, Frank Jobe was taking care of the baseball players, and he took care of a lot of people from other sports that had shoulder and elbow problems, but primarily, shoulder and elbow issues in throwers was what he was really known for. And I worked very closely with him, and he encouraged me, as I had said, to really advance some arthroscopic techniques in what we were doing. And so I did a lot of research on surgical techniques and how the techniques would perform, and had to get a good understanding of biomechanics of the shoulder and elbow. So I had done a lot of that research out of necessity for what I wanted to do. It wasn't just research for research's sake. It was really to help to inform me on the different things that we wanted to do. So I became rather expert at the athletic problems to the shoulder and elbow. At the same time, I was helping take care of the Rams and football players with Dr. Curlin, Dr. Shields, and in those players, the knee injuries are a big deal. And so I had also done some research during my fellowship and after my fellowship on different techniques that we were trying and on collateral ligament reconstruction and ACL reconstruction, and so I became expert in those types of injuries too. And just like in plastic surgery, handling tissues in one part of the body, it overlaps the skills and the knowledge of how to handle those
Principles.
types of tissues elsewhere. So,
Right.
so an Achilles tendon repair or a proximal hamstring repair, those types of things, there was a lot of similarities to what I needed to get done for patellar tendon repair or even rotator cuff repair. There's techniques that I developed to fix a rotator cuff that then, and I wasn't even smart enough at the time when I was developing the technique to understand how many other tendons in the body that those principles would work for. And so,
Well, let me just stop for a second, because I'm a surgeon but a layman. I heard, my eyes got opened up by some of the people recovering from Achilles that you had taken care of. That I thought, wow, what did you do? Was that some of the same thing that you're talking about?
yeah, the whole concept of putting of the repair that you're doing with suture, to add a load sharing support so that all of the tension wouldn't go right to the repair, and there would be something to share the load. So in that situation, if you could do a technique that was at time zero very, very strong, could hold the tissue still long enough for it to heal, and permit the joint to start moving so that you could get mobility back in the joint,
Rehab.
stimulate the muscle that is attached to that tendon to start to work. And we all know that tension helps tendons heal. It helps the collagen line up exactly where it's supposed to be to withstand tension. So, the quicker you could get them moving and using the tendon, the better the ultimate result would be, and certainly the quicker. And so the problem was doing that without ripping the repair apart.
Yeah.
And so, so
did you have a few rip apart before you got it down?
Well, when I started to do rotator cuff repairs arthroscopically, there were studies that were coming out that showed if you looked at them with an ultrasound or MRI scan a year or 2 years out, that between 60 and 90% of them had significant failure. So, that it seemed to me that, okay, well,
was that a false finding, or was it?
No, it was a true finding, and so that there's other things other than the tendon being intact that helped pain relief, that's done whenever you do a rotator cuff repair. So a lot of those people had pain relief, but as time has gone on, there are people now. When I look at people my age, when I was young, you'd say, well, why do you even need a rotator cuff? What are you going to do? But people are healthier. They've been listening to doctors like us say, hey, listen, you eat right, stay in shape, exercise, and so then they come in and they're in their 60s and they say, okay, listen, I've been doing everything you told me. I'm healthy, and I want to be able to continue this lifestyle. My rotator cuff is torn, so fix this thing. Don't tell me that, I don't really need to have a strong rotator cuff. And so, I knew that there had to be a better way, just because this was convention, this is how this is done. If 60 to 90% of your work is not staying intact.
Is mine okay now? It feels okay.
Well, you came along at a time when I had changed the way that we were doing rotator cuff repairs. And so you have all the load-bearing stitches that helped yours heal and got moving early. And you probably got moving a little too early and got too active and operated a little bit too early. And so, those sleepless nights you were talking about was because you were doing a heck of a lot with your post-op joint.
I can't sleep on my back. I had no pain, but I was sitting there every day on my back like, I can't do this. And that was the only complaint I ever had. Other than, I have to tell you, when I came out of Jobe, not out of your clinic, out of the clinic, I was, just got through anesthesia. I didn't know where I was.
Yeah.
I was just out of it. And there's not any bad statement towards you or your facility. But I came out and my wife got me in the car and a guy pulls up beside me and he started yelling because I guess Sulan had parked too close to his car. He got out of the car, started pounding on my windshield, and he wanted to beat my ass. I'm like, you know, I didn't even know where I was. Anyway, Sulan calmed it all down. It was kind of a funny experience, and we drove off. But that was it was traumatic.
I'm sorry about that. I can't. I'm not responsible for
I got too close
some of
to
the
the
riffraff that
parking
comes
lot.
in.
Well, you know, well, these techniques that you have now, you go back and people probably listening don't even remember who this is, but you know, Gale Sayers was this phenomenal career, and he got cut short by Kermit Alexander, I think, of the 49ers. He tore something in his knee. You could have probably extended his career much better than that.
Well, that injury was probably not even as bad as some of the other ones, like Tom Brady's injury. Same combination of problems that Joe Burrow. So those types of injuries that's what happens in football. These are train wreck injuries.
Yeah.
And so we've just over time gotten better at reconstructing the injured structures. The one thing that we really are really is on the horizon now is to be able to prevent cartilage damage. That's the beginning of arthritis, and so ways to replace and get cartilage to grow again. That's really
the next horizon.
That's the next horizon.
So I would think in your position, aside from patient confidentiality, I mean, it's one thing to say somebody had surgery, but if they knew how bad somebody's injury was, I mean, that's really loss of income you can't say football injury is like so bad because he can never play again. He's still out there trying to get employment. So that must be a very delicate, let's keep this hush hush and let him move on.
Well, you can't. You
can't.
You can't. In the crazy thing about my profession is that these guys that make a living with their body, there is no confidentiality.
Oh, wow. Okay.
And so, I mean, there's confidentiality about how I handle information, but what they have to do with their injuries and their surgery and that is disclosed to the next person who's going to pay them. And so, we've to some degree been a victim of our own success where, now people, whenever they see on the ticker tape that so-and-so is going to have a Tommy John operation or so-and-so has an ACL tear, they're already doing the math and saying, okay, let's see, on my fantasy team, he'll be back in October. Or
right.
And so assuming that everybody that has these injuries, they're going to come back 100%.
Mm-hmm.
And, people would be surprised at the statistics out there. I like to think that I work very hard to not be on the short end of those statistics, because unlike a lot of other surgeons, if you ever want to see how I'm doing, just, turn on TV.
Yeah.
And so I can't hide those results.
No, no. So would you advise somebody different that's a rising star, just drafted, first year of their career, huge star? Is he advised differently than a guy who's 38, who's kind of winding down, or you're just going to treat them both the same, put them on the field as fast as
No, that's the art of it, and that is also the benefit of having grown up in a environment like with at the Crow and Jobe Clinic, and is you learn the art of dealing with the whole package, the whole person, the whole situation they're in, what they have to do, where they are in their career. And I just today there some things have come in where you've got some people injured at the end of training camp now, and you know that if you do certain things one way, that it's going to be a lot of time missed, and if you do it another way, they're going to be able to come back this season. But the future, they're going to pay the price for that in the future because it ultimately may lead to earlier arthritis or whatever. So it's a holistic art, and by holistic I mean dealing with the whole patient.
So what's it like being the Rams and the Dodgers? What's that feel like?
For those two teams in particular, it's a blessing because those organizations are amazing. The medical staffs that they've allowed us to develop there are incredible, and the everything from the clubhouse to the locker room in football. I'm dealing with two of the greatest front offices ever.
Oh yeah,
and
sure.
So it's a blessing to be able to. The quality of those organizations is just really is life changing.
Fantastic. Well, I say it again. Without Neal, you turn on your TV and virtually every sports team would probably be missing their star. Neal, what's the biggest misconception people might have about what you do and your career? Is there one?
My career is pretty public, so I think that people know a lot about my career, but I don't. I'm not sure I know how to answer that.
Okay. Well, you probably don't have any misconceptions. You're probably pretty clear.
Well, maybe they think that it's just a given that people are all they're all going to turn out perfectly, and so I just.
Is it tough managing expectations? So much of it's part of rehab too. I mean, it's not just the surgery.
Right, and I think that probably is the answer to your question. The misconception is that I can do the surgery and that basically that's all that matters, and that's not all that matters. I work
maybe the easiest part.
I work exactly. I do a little bit of like Frank Jobe used to say. He said, "My boy, you're operating on really, really gifted human beings physically. You're going to do a little bit of surgery, and they're going to do a lot of work. And the therapists that are working with them are going to do a lot of work. And so get to know them, get to know what they do, and how they do it." Mm-hmm. And that was a great piece of information for me because my patients tend to go, they stay with me for a little while, and then they go. Mm-hmm. And I'm responsible for overseeing their therapy and everything until they get back on the field. Exactly. And so I think the biggest misconception is that it ends at the time that I'm finished in the operating room, and nothing could be further from the case.
So once you do a tendon repair, let's say an Achilles or ACL, do you believe that is stronger than what they had, a little bit more prone to having an injury, or how would you look at that?
No. Ultimately, I don't think that it is that we are able to make it perform better than the ligament God put in. And what we can do and we can get very good at is replacing it as close to perfectly anatomically as we can with tissue that will regenerate. The magic of the body is amazing, and if you don't have any respect for that, you're going to miss out on everything, and your results won't be any good. So, I think that the best we can do is to reproduce the anatomy with strong tissue, strong repair techniques, and strong enough to hold up to what the great therapists are going to do to get them functioning again. And so, it goes. That whole process goes on and on and on until they're back to doing what they do. And so I don't think that we can ever make it better than it was designed in the first place.
What are those things that you put in, the insertions, like vectors or something you say to attach? I forgot, those, you put 3 in me or 4 in me. What are those called?
They're anchors and implants. So, what we do, we have to anchor tissue to where we want it to heal. And so that was a big impediment to me getting from where we were to where I knew we needed to be. And so anything that I ever developed, the techniques or the techniques that I developed required ways to fix it. And so the intellectual property that I worked on was to solve a challenge that I was having to be able to do something the way I knew it needed to be done, for me to give them the best result. And as they say, invention is the child of necessity, and so what I did solved challenges that I had for particular things, and really wasn't genius enough or took the time to think, if it worked for me to do this, how many other uses those things would have. So the things that became really, really successful they were able to accomplish things for me, but they obviously had.
But they're now
uses
worldwide.
elsewhere. Yeah,
I mean, everywhere else.
yeah, and so there's a lot of things that still to this day can't be done unless you're using
Do
one of these
those
things.
dissolve, or what? They just stay there.
They're made out of different materials. They're rarely made out of metal anymore. We don't make metal anchors very much anymore. So they're either compatible with the body, so the body will turn them into fibrous tissue or bone type substrates. They're specially made plastics now, and they're not petroleum plastics.
Plastic that's my industry.
Yeah. So
plastic.
Well, no, but there's plastic material that is actually bone inductive, and so now with 3D printing and everything, you can make pretty much anything you want to make in any shape you want to make it. And so technology has had a significant effect and impact on what I'm able to do, including the suture material. Now you can impregnate suture with collagen, and so that's ongoing. And I wish I was at the beginning of my career to see the exciting things that are going to be, and it's coming faster and faster and faster because of technology.
Well, after this conversation, I plan on talking to you about using these anchors for my faces and breasts.
I think we talked about you do some pretty amazing things with little anchors. You described to me some of the things that you've thought up, and I love that. I love when people are thinking of ways to overcome the challenges and not waiting for somebody else.
Maybe we could switch operating rooms for a day. You can come and do mine. I'll come and try yours.
Well, I tell you what, I'd rather help you. I can't do what you do.
If I tried to do your surgery, somebody would be out crippled. It'd be in bad shape. So Neal, this is a question: What makes you better than everybody else? Why are you better?
Well, the first thing is that I have enormous humility to know that I am not better than everybody else. I live with the sense of gratitude that I want to be as good as I can possibly be to repay the good Lord or my previous mentors and anybody that had an impact on my life. And I owe it to the people that are looking at me and telling me, listen, I trust you with my loved one. I trust you with my body. Take care of me. And that for me is a sacred
That's an
thing.
incredible.
And if you're a surgeon and you can't remember the first person that looked at you and said, take care of me, operate on me, then you've missed the entire thing. So to answer you, I don't think that I am. I want to be as good as I can be, but there's a lot of great people out there. I just happen to have found the place that I can work and the type of work to do that I make the most of everything that God gave me.
You enjoy it. You're passionate about it. It's fun to you.
And
like you said, the payoff is the person that lives because you saved their life. The person that feels better and they're confident. The person that can go back on the field and perform and pay his family, enjoy his life. I mean, the payoff is, the surgery is fun, but it's enjoyable to see what you're getting at the end.
Extremely rewarding.
What a grace.
And you. But the other side is, you really are so involved that if it's an injury that just can't be made normal again, I mean, you go through that with the person, but I think that's part of being a physician too. When they believe that you're doing everything you can, and if it's not working out, that you're the person they're going to. If they don't have you to empathize with that, then they really have no one.
Have you ever said, no, you're not going to operate on a patient because the procedure was too bad? The injury was too bad.
Well, I think that there's maybe other things that they would need that is not in my expertise, that somebody else would need to do, to help to make them better. I've had people that you have two people come in with the same injury, but that injury is attached to two different people, and surgery is right for one of those people, and it's not right for another.
Yeah,
that too.
I get it.
And if you're not good enough to spot that, you're going to fail.
I think that's one of the things I think I've learned the most in my career was the most powerful word is no. And I probably have different pressures than you have, and I can easily say no, where you is like, wow, it's harder for you. I think that you're probably under more pressure than me. But being able to recognize the person you're dealing with, the psychology behind everything, their abilities to follow directions, and maybe to do all the rehab. I mean, that's something I guess you got to be able to spot.
Well, people probably think that you and I operate on everybody that comes through the door asking for surgery.
People. No.
And it's not true.
No.
And some of the people that I have said you don't need this operation, you're going to do better without me operating on you. At first they think, oh, I'm not, a good enough athlete, or I'm not, think I'm pretty enough in your case. Those are the patients that when it turns out like you told them it would, are the most appreciative, and they are your biggest fans because you told them, I'm not going to operate on you.
Well, I'll tell you, when I tell people I'm not going to operate on you, the happiest ones for me are the husbands. They're like, she didn't need this surgery. She looks so good. And, and the problem is people come in, and especially after a divorce or something like that, they want a facelift, they want this, they want that. And I said, that's the wrong reason to have a surgery, just because you're depressed or, some catty girlfriend got after you. But I'll tell them, no, you don't need this. And they'll get on the phone and somebody's, oh, it's an emergency, come to my office. And they'll do it. And they just do it. And I had a little Saudi princess who was like 22 years old. This was many years ago. And she wanted a facelift because she said, look, I can move my skin. I said, hell, you could take a 3-year-old and do that, right? I didn't do it, but she came back like 3 years later with somebody done it. She had the worst scars all around, which is kind of part and parcel with the person would accept a patient like that, probably know what they're doing. But there's always somebody out there to do it. And which I also heard in my career, if you don't do it, somebody else will. I'll say, fine, that's not a reason to do surgery. Why would that make me want to do surgery? Because somebody else would do it. I didn't let them go. Have you ever been starstruck by one of your patients? I'm sure not anymore. I mean, but with maybe the first one, who is or if you can name it, is there one that was like, wow, I can't believe this?
As far as athletes go, I had personal interaction with would have been maybe John Elway. Yeah. I just loved the way he approached, his problem, his injury, and so I can't say I was starstruck at the beginning when I first see them, and I've seen some astoundingly beautiful women and handsome men. So sure, I mean you're sort of taken by it, but it's not until I get to see them in this situation, which is a very vulnerable situation for them, and that I become starstruck because of the way they handle, the way they approach the whole problem they're having. That for me those are the special people.
Yeah.
I learn a lot from my patients. I learn a lot from, and I've had some young professional football players that have no business being as positive and as insightful, and they have the kind of humanity that it takes a lifetime to develop. And some of these young guys and girls are just, I mean, it's amazing the people that are out there. And so I get starstruck basically going through the process because I'm so impressed by, how they handle it.
Right. Well, I remember my first one. It was a very long time ago, and I thought of this because you had mentioned, I think, the Beverly Hillbillies, but it was back in the day, Green Acres, I think that's what it was. And my mentor, Dr. John Williams, was married to Ava Gabor. He'd had 10 wives, 2 of them were the same. Everybody in this story is dead. He had 10 wives. 2 of them were the same wives that he kept going back to, because that eats you up, that payment, for the ex-wives. And he said, I went back to one and I just felt comfortable because I saw all my furniture and all my stuff. So I just wanted to go back with her. But anyway, she was married. He was married to Eva Gabor. And that was very brief. And he had said he saw her in an elevator, years after. And she looked at him and says, who are you? He says, I used to be your husband. But so my first one, Jaja came in, I was, she was my patient. And she used to take me, I'd go to her house once every week, come over, have tea with me with her little poodles. I'd drop, by the house on the way home, play with her poodles, talk to Jaja. And, that was that. And one night at Eclipse Restaurant, that's how far back that goes. It was Morton's after that, but before it was Eclipse in L.A. And I went to Eclipse Restaurant with my friends. I was sitting there at a table, and I looked behind me. Jaja's there with 8 people. I said, wow. I tapped her on the shoulder. She turned around, looked at me. She gave me the nastiest look I think I've ever seen in my life. I said, hi, Jaja. She didn't even respond. She just snarled at me. I turned around, and it was like that point where I knew I was right, but I thought, is there something wrong with me? It looks just like her. I know Eva's dead. All right, so I went to the bathroom. 20 minutes later, I come out of my bathroom. She's standing right there. She points her finger in my face. She says, don't you ever talk to me in public again. And I was like, wow. So these are the rules of plastic surgery in LA. And then I didn't want to go out because I didn't know to say hi. And if you don't say hi, they're like, oh, you asshole, you operate on me, you don't even say hi. So it's very confusing and complicated.
Must be hard.
Yeah, and my dental friends are always taking pictures of their patients. Like, I could never do that. But, look at my smile. My dentist just saw me, my hairstylist. But, that was kind of the world in LA back then. But
the gift of that, the other side of the coin is, though, medicine gives you an opportunity to be probably the most intimate relationship that people have is with their surgeon. Yeah. And I'm not talking about intimate in an appropriate way. I'm talking about is human being to human being.
You're cutting them open.
It's an amazing gift. And so being able to take care of some of the people that are real heavy hitters like you do, or for me having that relationship with like Kobe or Tom Brady, and you see what it is that makes a human being great at what they do, and it goes far beyond the tangible physical ability.
Yeah, what a wonderful career, and like you said, the ability to do this and have people trust us is the greatest honor that I think. I don't know anything else that could provide something like that. We kind of got beat up for a long time in our life studying and going through residency programs, which are hell. But now it's a great place to be. And I was going to ask you, if you weren't going to be an orthopedic surgeon, what would you be? But it sounds like you'd be a cardiac surgeon. Yeah. So I guess that's what you'd be. And if you couldn't be in medicine, do you know?
I think I probably would have been a pilot.
Okay.
My grandfather was a World War I pilot, and he was an amazing man, German, but just a really amazing person, and he was very proud of me. There was in our little town, there was a guy that owned a grass airstrip, and my dad worked on the barter system a lot. He took care of the United Mine Workers, and so if somebody had a grocery store, you got fruit, and if somebody had a work boot place, that's where you got your boots. Well, this guy owned a little grass airstrip, and so he said, "Listen, I'll teach your kid how to fly." And so I was about 15 or 16 years old and taking flying lessons. My grandfather came out incredible. There, and the first time I soloed, he was standing there on the grass airstrip, and I pulled up to the little prop plane pulled up to and stopped, and he went out and I had a T-shirt on. He took my T-shirt. He said, "Take your shirt off." Took my shirt, and he ripped the shirt and hung it on the propeller. And that was the first pilots. That was the tradition when you first did a solo. And so I think I probably would have done something like that. Maybe I'd have been.
So
in the
if
military.
you're in the American Airlines going to New York and something happens, could they call you? Would you be able to help at all?
No, I when I went off to college, I thought, oh, maybe I'll still tinker around with this. And I learned really quickly. I forgot to do something right before I was taking off, and luckily I spotted it. And I realized that if you're tinkering with that, you better get out of that endeavor with flying. So I knew that's that went by the wayside. But at the time, whenever you're thinking about what am I going to do in life, that was pretty cool.
Right.
I a long time as a kid.
A great memory, 15 years old.
Yeah, but I thought that maybe I'd be an athlete, pro athlete, but you get really quick whenever you find out that you get to college and there's a lot of people that are better than you.
Right.
So,
what does it look like your life outside the operating room if you have one? I mean, I was operating until 9, 10 o'clock every night last 2 weeks, but I'm sure yours is probably even worse, especially this time of year.
Yeah, this time of year is particularly tough. From now through the end of October into mid-November is really, really tough because you got all three sports that I take care of getting going. And it's helpful to have a family that understands what you do.
And they're married to medicine.
They are married to medicine. That is true. They are married to medicine, and but that's the way they've come up. It's natural for them. And my wife will joke around that she'll get a phone call with no warning that so and so or this kid's in town. It really doesn't have anybody with them, and so I want them to stay at our house for a couple of days just because I can't send them to a hotel, and
that's
so
nice.
she's pretty prepared that she'll complain about it, but she'll because she's just not doesn't have the place prepared.
Yeah.
But so my family is it's a family affair for sure.
So you probably, let me see if I can guess this. Okay, you get up early, do your surgery. It's easier for you than making breakfast for yourself. You love the surgery. Maybe you skip lunch. Maybe you have some coffee. At some point, you got to comfort eat because it's like, I worked so hard. I'm going to have this to eat. You just start eating. Then you get home. You're dead tired. You just want to go to sleep, and you're thinking about the next day. Is that kind of your day, or?
Yeah, but see, the comfort eating happens when I get home, and then I end up eating one meal for that day, and then
you're fasting. Maybe you're fasting though.
Yeah, but I make up for it with it. But then I don't have much to give as far as if somebody asked me my favorite color at the end of a day like that, I would struggle to respond.
Yeah.
It's
black, so you can close your eyes.
Yeah, exactly. But the interaction, the constant need to respond to somebody, it just that's the most mentally fatiguing thing, and because you have to be on for them, and so to be able to let your family know that not to measure your love and devotion for them by your ability to pay attention to. When your two daughters say that they had a little spat because one girl borrowed the other girl's clothes and ruined the thing, and I actually it's an escape for me, but I don't want to respond to it. I just want to be.
You want to relax.
Exactly.
You really want to relax. Well, do you know is an interesting question for you? I'm comparing this to my own life. At what point did your daughters really know what you did, and like how big, a footprint you had in the world?
I don't know that they really that they know the difference between maybe they whenever they want to go to a sporting event or somebody comes over to the house and they realize that this is somebody that everybody's talking about.
But they don't care if they're the lead player of any team, but if they're on YouTube, if they're a YouTuber, then they're going to know who they are.
Exactly.
Yeah.
And I remember one time I called home, and this has happened to me a couple of times, that people in their generation, performers, and I'll call home and I'll say, I'll get one of my daughters on the phone. I'll say, okay, honey, who is this person? And they'll say, are you kidding? You don't know. And then, so now I know that this is going to be something they're going to be very, very interested in.
Right.
So,
I want to do something. Oh, this is what I want to talk to you about. What's PRP and stem cells? Let's go through that, because in my world there's a lot of hype, and I'm sure some of it's good and some of the future is great. But where do you see all this?
There's the natural effects of the anti-inflammatory effects, the tissue growth type effects that our own body carries is very powerful. The problem is that the way it's used and what is meant by quote stem cell
Daisy stem
therapy.
cells. Yeah, right. Could be.
It's all over the map, and people really, when they come in, they're asking. They really don't even know what they're asking for. They throw the term stem cell treatment around. Well, the fact is, in this country, unless if you're involved in a clinical trial, you can't manipulate somebody's stem cells and put them back into somebody.
Did you go to Panama or Mexico?
Yes, you can, and a lot of athletes do, and a lot of people do.
Do you think it works?
Yes,
Okay.
I do think it works for some things. I think that it is not well enough studied. There's untoward effects that I've seen. Things that have been done even in this country, where the effect of what you're doing by turning on that biologic activity, it's put into overdrive, and you can get a hyper response that can make the tissue that you're fixing temporarily very weak.
Wow.
Think about it
So there's downsides.
when you stimulate the healing response. The first thing that has to happen is blood vessel invasion. Okay, and when blood vessels are stimulated to invade, it's like turning that piece of tissue into microscopic Swiss cheese. The mechanical strength of that tissue temporarily goes down.
Right.
And this happens everywhere that we take one tissue and put it in for another tissue. And so if you supercharge that effect, you can get a very, very weak piece of tissue. The problem is you can't sense it. There's no nerve endings that tells you that. And so you're going about your rehab and your therapy, and maybe you're breaking the rules a little bit. And before you know it, you've destroyed the thing. And so I've seen that happen. I've seen excessive scar tissue formation. So I don't want to bash it, because it is the way of the future. Since we now have cracked the genetic code, gene therapy and stem cell therapy, and using the immune system to help our healing, that is where we're headed. And that's going to be the answer for a lot of the ailments that we have, cancer and tissue healing, everything else. But, it is not ready for prime time for everything that the people
I agree
expect.
with you, and the people come in the office asking for all these things. And I think at this point, and even earlier, there's been more hype. I mean, there's been more of the marketing angles have been really more impressive than the true innovation of where we were. And so, it's a good way to sail and, get people in the office, but really we don't know yet. We're hoping to get there, and we will get there, but, today's not the day. So you've been described as more than a surgeon, sometimes a mentor, a therapist, a friend. Is that intentional, or it's just part of being a surgeon and going through these injuries with patients?
I think it was probably natural selection. That was always part of my personality. I consider it the greatest, gift and privilege that I could ever have in my life, is the ability to be intimate with another human being, and that means that everything from communicating, understanding. So it's just always been part of my life, and it's something I really appreciate and I cherish. And so those things are very important to have a healing environment, a healing approach to
and you've
people's
gotten
problems.
good at it. Yeah. So I want to ask you rapid sequence questions here. You're sitting in your office, the phone's ringing, and your secretary says, I want you to name the injury that you would expect to come in. We've got an NFL player coming in.
2 ligament injury to the knee.
Okay, we've got a Major League Baseball player coming in.
Ulnar collateral ligament. And question is, does he need a Tommy John?
Okay, we got an NBA basketball player coming in.
Bad patellar tendonitis and partial tear of his patellar tendon.
Wow. And then we've got a guy that just came off the slopes of Aspen skiing.
Yeah, shoulder dislocation and torn rotator cuff.
Okay, ACL maybe too, right?
ACL skiing is the primary one, but I didn't want to be that sort of pedantic and common for you.
Pickleball.
Achilles.
Wow, I stretch mine very good every time.
What are you doing playing pickleball? You're too good an athlete for
No, I
that.
play pickleball. I love pickleball. So we just have a housewife coming in. She's been working at home.
She has bad tennis elbow.
Okay, we have a CEO who's just fired a couple people. What about him?
He just wants to talk.
Okay. All right. Well, we're here with Dr. Neal Elattrache. Had such a great conversation with him. What a great show. It's time for me to answer 3 plastic surgery questions. So I'll ask that. There's one from Amanda on TikTok. She said, "You did such a great job on Kylie's breasts. I would like to have the same technique. What can I do?" So, well, a lot of people do this technique, and it's partially underneath the muscle. You can't use the same implant. It's not going to look the same on her as it looks on everybody else. I've said that before, but you have to go to a good surgeon and just show him the after picture, and hopefully he uses that technique. And not all surgeons are the same, but there's a lot of really good ones out there that could help you. This next one: can all surgeons do your technique, or is it preference, or is it a preference, or is there skill involved? And this is from Peptide Beauty. Anyway, I think surgeon skills are different. I trained a couple surgeons with my technique, and they still couldn't do it. There's probably some people out there doing it better than me. But I think that if Michael Jordan showed you how to shoot a 30-foot jump shot 20 times, you still might find people can't do that. So there's people that can do it, people that can't. But I think if you look at patients that are happy and look at good before after pictures and find a surgeon, you'll be able to get the same technique. What's the difference between a brow lift and a facelift? Brow lift is really basically elevating the brows, which is above the eyebrows, and the facelift is everything pretty much underneath, excluding the eyes, and that includes the neck. And brows can be raised, they can be lowered. You can modify muscles to remove or improve wrinkles. There's a lot of different things. So brow lift is a very common term, and you have to really break that down into areas and what you're really trying to accomplish. And the face also is different for everybody. There's no cookbook facelift because you can spend 3 hours on a neck just to make that look really good. These are long discussions, and you need to spend time with your doctors that you're interviewing. Well, Neal, it's been a great interview with you. Love hearing about your stories and how you got where you got, and I'm honored to have you here on the show. And I just want to say thank you for coming. And
it's a real privilege to be with you, Garth. I when you asked me to do this, it really meant a lot to me.
Oh, thank you. Thank you. Dr. Garth Fisher, The Cutting Edge, been with Dr. Neal Elattrache, premier orthopedic surgeon in the world. And don't call his office, try to make an appointment. He's already filled up. But
No.
Anyway, if you want the best, he's right here. Thank you, Neal.
Thank you. Thanks, Garth. Thank you very much.
I want to thank KCBS, Odyssey, and our sponsors, and Cal and Mike, who are our producers, and, of course, our listeners, you. Appreciate all of you. I'm Dr. Garth Fisher with The Cutting Edge. We'll see you next week.